Subscapularis repair in a lateral position. Here we can appreciate that is a subscapularis tear. You can see the coracoid right there, and the short head of the biceps is also visualized. You can see that this is the tip of the coracoid. The conjoint tendon is seen nicely from the tip of the coracoid, and the torn subscapularis is seen just beneath it. This is also called as a subcoracoid impingement or the roller winger phenomenon as described by Dr. Stephen Burkhardt. Now what we want to do is to repair this rotator cuff or subscapularis tendon, and therefore we make a window just lateral to the tip of the coracoid, and in this position we do a maneuver which is called as a posterior lever push maneuver. This will make the footprint more approachable, and then we put a self-tapping anchor onto the lesser tuberosity, and here in this case we are using a fully threaded metal titanium anchor, and this will be used to repair the subscapularis tendon in a single row fashion. We can appreciate that the anchor is inserted on the uppermost facet of the subscapularis tendon, and when you drill it, when you put it, you are very close to the coracoid, and you are also very close to the head of the patient or the eyes of the patient. So you have to be very careful while you are putting this anchor into the position. So when you put the anchor into the position, then you can use the landmark, specifically the comma sign, to actually evaluate the tear and repair the tear. So there are many techniques. You can repair the subscapularis tear in an antegrade way, you can repair it in the retrograde way. But if the supraspinatus is torn, a very easy way is to put a cannula in and repair the tear with a suture passing device like a first pass. So here we are using a first pass ST to sequentially pass the sutures through the subscapularis tendon, and here we are doing a single row repair. So we are passing the sutures one by one here. The first suture is the Mason Allen repair is the state of the art repair in these kind of subscapularis tears. 3 suture limbs are passed and then they are tied one by one. So here one suture will be a mattress suture and one suture will be a simple suture. So 2 of the black colored sutures are passed and 1 of the white colored sutures are passed. First we will tie the black colored suture into our own position, and then we will be tying the white colored suture. So that will be a modified Mason Allen construct, and we can see that we are able to achieve a very nice fixation of the subscapularis tendon with this kind of a single row. And if needed, we can do a little bit of decompression of the subcoracoid space later on to reduce the chances of the roller ringer phenomenon. Here you can see that after repair, the subscapularis tendon is seen very nicely. The black colored suture is repaired, and then the white colored suture is repaired over and above that. And this is what is called as a Mason Allen or a modified Mason Allen subscapularis repair. So this is the final picture of the repair, and you can see that the subscapularis tendon is very taut and very nice in tension in its particular place, and we are able to achieve a very good repair with a single row technique using a self punching anchor in for this kind of a repair. So understanding the subscapularis tear is important.